difference between the people who survive hantavirus exposure and the people who do not is almost entirely determined by two things: what they knew before the exposure happened and how quickly they sought medical care after symptoms began. Let me tell you about two people. For privacy, call them Gerald and Carol. They were neighbors in a rural community in New Mexico, both retired, both in their mid-60s, both in reasonable health for their age. In early April, they spent a weekend together helping Carol clear out a detached storage building on her property that had been shut up all way. Gerald developed what he described to his wife as the worst flu of his life. Fever, muscle aches so severe he could not climb the stairs without stopping, a headache that did not respond to over-the-counter pain relief, and a fatigue that felt different from ordinary tiredness, heavier, more total. His wife wanted him to go to the emergency room. Gerald said he would wait and see. He waited 5 days. By the time the ambulance reached their home, he was in respiratory failure. Gerald died 9 days after his symptoms began. Carol developed almost identical symptoms 4 days after Gerald. Her daughter, who had been following news coverage of a hantavirus cluster in the region, drove her to the emergency room the same afternoon the fever started. Carol told the triage nurse exactly what she and Gerald had done in that storage building. Those 6 words changed everything that happened next. The clinical team escalated immediately. Carol spent 11 days in intensive care. She was discharged 3 weeks after her symptoms began. She told me later, "The only difference between Gerald and me was that my daughter knew what we had been doing that weekend, and she knew what to call it." The most important section of this video is the one you are about to hear, because the most common misconception about hantavirus is the one most likely to cause harm. The misconception is this: that to be at risk from hantavirus, you need to touch a rodent. You need to be bitten. You need to find a mouse in your home and handle it. You need, in some direct and visible way, to come into contact with an animal. You do not. Not even close. Hantavirus is carried asymptomatically, meaning with no signs of illness, by specific rodent species, primarily the deer mouse, whose scientific name is Peromyscus maniculatus. These animals carry the virus in their saliva, their urine, and their droppings. They shed it continuously. They do not become sick. They do not behave differently. There is nothing about an infected deer mouse that would alert you to its presence or its danger. And the deer mouse is one of the most widely distributed small mammals in North America, found in rural areas, woodlands, fields, and increasingly in structures, sheds, barns, cabins, crawl spaces, storage buildings, where it seeks warmth, shelter, and food. Here is what most people are never told. Transmission Route 1. Inhalation of aerosolized particles. When infected rodents urinate, defecate, or shed saliva in an enclosed space, those materials dry. They become dust. And when that dust is disturbed, by a broom, by a moving box, by a shaken-out blanket, by the simple act of walking through a space that has been undisturbed for months, those dried particles become airborne. Think of it like chalk dust on a blackboard. You cannot see it lift when you clap the erasers, but the air around you is full of it for several minutes after. The virus lives in that dust. It requires only minutes of inhalation exposure in an enclosed space to establish infection. Carol and Gerald swept a concrete floor. That is the mechanism. That is all it took. Transmission Route 2. Direct contact with contaminated surfaces. Rodent urine, when dry, is invisible. It leaves no stain detectable to the naked eye, no odor in small quantities, and no warning that a surface is contaminated. A workbench in a closed shed, a shelf in a storage room, the floor of a cabin that has been locked for 6 months. Any of these surfaces may carry dried viral material that transfers to the hands of anyone who touches them, and from the hands to the eyes, nose, or mouth, which is how infection enters the body. This is why the protection is gloves, not caution. You cannot see what you are touching. Transmission Route 3, and the one most people assume is the primary risk: direct rodent bites. This is, in fact, the least common route of hantavirus transmission. The majority of confirmed cases in North America involve people who were never bitten, never handled a rodent, and in many cases, never saw evidence of rodent activity in the space they were cleaning. The absence of visible droppings does not mean a space is clean. Historical contamination, material left months or years earlier, can retain infectious viral particles when disturbed. Drop your location in the comments right now. City or state is fine. And tell me, do you have a shed, a cabin, a storage building, or a crawl space on your property that has been closed since last fall? I read every comment personally, and the pattern of where people are responding tells me something important about where the current risk is concentrated. The second reason is reduced pulmonary reserve. Hantavirus pulmonary syndrome kills through a process called non-cardiogenic pulmonary edema, the flooding of the lungs' air sacs with fluid. This fluid does not come from the airways. It comes from the damaged blood vessels surrounding the lungs, which the virus attacks directly. Think of it like water seeping through the walls of a vessel from the outside in, rather than pouring in through an open top. In a younger adult with full lung capacity, this process must advance significantly before oxygen levels fall to a critical point. In an older adult with existing reduced lung function, with cardiovascular disease that limits how much oxygen the heart can deliver to the rest of the body, the same degree of lung damage reaches a critical threshold far more quickly, sometimes by hours. This is why early presentation to emergency care is not a precaution for older adults with potential hantavirus exposure. It is the intervention itself. Hantavirus pulmonary syndrome progresses in two distinct phases, separated by a period of apparent stability that is one of the most clinically dangerous features of the disease. The first phase, called the prodromal phase, spans roughly days 1 through 5 after symptoms begin. During this phase, the virus is replicating and beginning its initial attack on the immune system. Symptoms include fever, typically between 38 and 40 degrees Celsius. Severe muscle aches concentrated in the thighs, hips, and lower back. Persistent headache, chills, and in approximately half of all cases, gastrointestinal symptoms, nausea, vomiting, diarrhea, or abdominal cramping. Here is the critical clinical detail of this phase. There is no cough. There is no runny nose. There is no sore throat. The respiratory symptoms have not yet appeared. This is exactly why the prodromal phase is so dangerous. It presents as a severe flu, and without the exposure history, neither the patient nor often the clinician has any reason to suspect hantavirus. Gerald's physician prescribed rest. Gerald rested. The virus continued its work. The second phase, the cardiopulmonary phase, arrives on approximately days 5 through 10, often within hours of the first respiratory symptom appearing. Shortness of breath begins. The lungs are beginning to fill. Within 24 to 48 hours of that first breath of difficulty, some patients are in acute respiratory failure, requiring mechanical ventilation. The progression is not gradual in the way that most respiratory illnesses progress. It is sudden. The word worsening is the critical qualifier. Shortness of breath that holds steady may allow for a monitored response. Shortness of breath from hantavirus pulmonary syndrome does not hold steady. It progresses. By the time it feels serious enough to warrant emergency care, the window for effective intervention may already have narrowed significantly. Do not wait. Do not monitor. Do not call a nurse line and describe your symptoms and wait for a callback. Go directly to an emergency department today, not tomorrow, if you are experiencing new, unexplained shortness of breath within 4 weeks of any activity in a potentially contaminated enclosed space. Ventilate before you enter. Before setting foot in any enclosed space with potential rodent activity, a shed, a storage room, an attic, a cabin that has been closed for the season, open every window and door available and allow cross-ventilation for a minimum of 30 minutes before entering. Fresh air movement dilutes the concentration of aerosolized particles in the space more effectively than any other measure available without specialist equipment. The common mistake is opening the door and walking straight in. Wait the full 30 minutes. Never sweep or vacuum dry rodent droppings. This is the rule most people get wrong, and getting it wrong is the mechanism by which most infections occur. Sweeping launches dried rodent material, droppings, nesting debris, dried urine residue, directly into the breathing zone of the person cleaning. Any area with visible rodent evidence must be wetted first with a disinfectant solution. 1 part household bleach to 10 parts waterworks, or any EPA-registered disinfectant, allowed to soak for 5 minutes, and then wiped up with disposable paper towels. Moisture prevents aerosolization. Wet it first, every time, without exception. Use a properly fitted N95 respirator, not a surgical mask. This is a distinction that matters clinically. Surgical masks are not designed to filter particles at the size range of dried viral material in aerosolized form. An N95 respirator, properly fitted with the metal nosepiece pressed against the bridge of the nose to create a seal, filters 95% of airborne particles in the relevant size range. Pair it with nitrile gloves. Both items are available at any hardware store for under $20 combined. They are not optional in any space with evidence of rodent activity. Seal entry points. Deer mice can enter a structure through a gap as small as 6 millimeters, roughly the diameter of a standard pencil. The exterior of any outbuilding or seasonal property should be inspected for gaps around pipe entries, foundation cracks, gaps beneath doors, and openings along roof lines. Steel wool packed into the gap and covered with caulk or expanding foam creates a barrier that rodents cannot chew through. This prevents new contamination. It does not address historical contamination already present in the space, which is why the cleaning rules above still apply even in newly sealed buildings. Tell me in the comments, after watching this, is there a space on your property or a property you visit regularly that you are now planning to approach differently? I want to know because your answer may help someone else who reads this thread. Gerald and Carol did identical work in an identical space. They breathed the same air. They touched the same surfaces. They were the same age, in similar health, in the same rural county. Gerald did not know that what he was experiencing was not a flu. He did not know that shortness of breath was coming, and when it arrived, he assumed it would pass. He waited 2 days after his breathing became difficult. He was 66 years old, with no prior cardiac or respiratory diagnosis. He was not the person most people picture when they imagine a hantavirus fatality. You now know what Gerald did not. You know that inhalation, not animal contact, is the primary transmission route. You know that the prodromal phase presents without respiratory symptoms and is easily mistaken for influenza. You know that shortness of breath in this context is not stable, it progresses, and that it constitutes a same-day emergency. And you know the 5 words that must accompany any medical visit following potential exposure. I may have been exposed. The information in this video costs nothing to carry. It may cost everything not to have. Share this immediately with anyone in your life who owns or visits a rural property, cabin, or seasonal outbuilding. Anyone who does regular spring cleaning of enclosed outdoor spaces. Anyone who lives in or travels to the western or southwestern United States. The person who needs this information most is almost certainly not looking for it. That is why you are sharing it.